Here is exactly what to do if you have cortisol dysregulation. 1, prioritize sleep. Sleep heals all. So you probably need somewhere between 8 and 10 hours of sleep if you're in cortisol recovery. If falling asleep and staying asleep is a challenge, opt for things like magnesium glycinate, L-theanine, magnolia, and maybe ashwagandha to help you fall asleep and stay asleep and avoid cortisol spikes that wake you up. 2 is start eating whole foods and nourishing foods. You got to ditch all the ultra processed stuff. And yes, that includes protein powders and protein bars. You specifically want to make sure we're getting enough protein, 30 grams per meal, and enough omega-3 fatty acids. Those are going to be found in fatty fish. My favorite source is sardines. This is going to help balance your blood sugar because blood sugar spikes and dips are another trigger for making cortisol dysregulated. You want to ditch all the intense exercise and opt for walking, something really low intensity, and maybe something like Pilates or weight training. Nervous system regulation. This is not talked about enough. We want to make sure that we're in a parasympathetic state by stimulating the vagus nerve. Breathing exercises are excellent here. Something as simple as box breathing, where you breathe in for 4 counts, hold for 4 counts, out for 4 counts, hold for 4 counts. Somatic exercises are another good one here. Okay, now on to supplements. Magnesium. Anyone with nervous system dysregulation, cortisol issues needs more magnesium. My preferred type is magnesium glycinate. You also need adaptogens. This is the heaviest hitter. Besides lifestyle, this is the heaviest hitter. I really like doing blends here because usually it's dysregulated, so we need some support for bringing up cortisol and balancing it and avoiding those really high spikes. So I like to do a combination of ashwagandha, holy basil, rhodiola, licorice, and ginseng. These typically need to be taken daily for several months. You should start to feel better within like the first month or 2, but the work is not done. You want to make sure that you're actually rebuilding your adrenals and cortisol, so at least 6 months on something like this.